why does anybody need to be on testosterone in the first place? It's going to help you feel better, sleep better. You're going to have more energy. You're going to be able to have an erection more easily and for longer. But the most important thing, the very, very most important thing, and the number one reason everybody should be on testosterone that's going to help you live longer I see a lot of men for low testosterone or low T. The most common complaints coming in are either, hey, I don't have the energy that I used to have, or even, hey, I'm not having the sexual arousal that I used to have. So the most basic question that I ask, and the first question I ask when talking to anybody who's concerned about low T is, do you have an erection every single morning? That's the most easy baseline way to check whether your testosterone levels are appropriate for you or not. The reason this is such a mystery here in the medical community is the way that we test for testosterone is not age specific. And so if you go to a lab right now and you check your testosterone levels, they're going to give you a range between 0 and 100 and say anything within this is normal. And that's normal for somebody who is 12 years old to somebody who is 80 years old. Well, that doesn't really work out in real life. In the lab, sure, that's fine. That helps differentiate between really abnormally high or really abnormally low levels. But the testosterone level for an active 30 to 40-year-old man should be wildly different from a 12-year-old boy. It should be wildly different from a 60-year-old man. And so that question that I ask, that erection every morning question, is really just a baseline. And if you're not, then we dive into getting the right labs and looking at what the right levels are. Now, there's no one set number that I have as far as what you need to be at for your testosterone. What I want to see in you is clinical efficacy of the testosterone. What that means is it's working the way you want it to work. So let's just kind of backtrack a little bit. Why does anybody need to be on testosterone in the first place? Because if you ask me, any man over the age of 30 who's not actively trying to have kids should probably be on a testosterone supplement. The reason for that, it's going to help you feel better, sleep better. You're going to have more energy. You're going to be able to have an erection more easily and for longer. But the most important thing, the very, very most important thing, and the number one reason everybody should be on testosterone is it's going to maintain your lean muscle mass. The number one indicator for longevity in your life. So the number one thing outside of everything else that's going to help you live longer is your lean muscle mass. That's why you see a big push now in health around protein, around weightlifting, because we're realizing more how important and how significant lean muscle mass is in terms of your overall health and your longevity. And that's why most people should be on testosterone, because it's going to help you live longer. That's why I tell people, like, listen, erections are great and sleeping better is great, but I want to live longer. That's the number one reason you should be on testosterone. So if you come to me and we have this conversation around low testosterone, how we can help, the next step is going to be getting some lab values. And we run a pretty comprehensive men's panel analysis to not just look at your hormone levels, but also to look at your blood count, your metabolic count, your liver tests, and a number of other tests that are going to help us determine what the best approach is for you. Lately, I've been talking about and using Kyzatrex, which is an oral form of testosterone. We've talked about this in some other videos in the past, but just as a recap, there have been oral forms of testosterone before. However, the problem with them was they would go through first pass through the liver, meaning once you ingested it, the drug would get absorbed into your bloodstream and then would go through the liver, where it could actually cause some pretty toxic side effects to the liver and some liver damage. Kyzatrex is different because it's not absorbed that way and doesn't go through first pass through the liver. Kyzatrex actively works by getting lymphatically absorbed into the lymphatic system. And so you don't have any of the nasty liver side effects that you were having in the past. And so that's why it's such a good option. The other reason that I really am fascinated by this drug and liking the way it works is the mechanism behind it. You can now have more or as much free or bioavailable testosterone as you're having with injections. So what happens is you get the efficacy from the testosterone, the feeling better, the sleeping better, the erections, all of that. But now you don't have the side effects that you have with other forms of testosterone. And so the side effects are less, which is incredible because that's the downside of testosterone, right? Is you get oily skin, you can get acne, it can cause your blood to get thick, requiring some phlebotomy or blood donation. It can cause changes to your sperm count. And so there are some trade-offs when you take testosterone. Kyzatrex, though, is dramatically reducing those side effects, but giving the same result. And so for me, that is like a no-brainer. Not only do I not have to inject myself, I'm now going to get the same results with less side effects. I had an interesting little science experiment with this. We just went to Bali for our honeymoon, and before we left, my wife packed a little pill case for me with all of my supplements, including my Kyzatrex in there, and I left it in the car. And so we got to LA, where we were staying for a few days before leaving for Bali, and supplements is one thing, but I need testosterone. I can't just go off of testosterone for the next 2 weeks. And you really don't want to do that because it's going to fluctuate your levels. Again, you won't sleep as well. Your energy will be off. Erections will be off. Not what I wanted to deal with on a honeymoon. And so I wasn't able to get Kyzatrex called into a pharmacy for me because of the way it is prescribed right now, but I was able to get injectable testosterone prescribed. And so after switching from injectable testosterone to being on Kyzatrex for 6 weeks to then going back to injectable testosterone for 2 weeks, we got to do this little science experiment. What's interesting is within 3 days of me injecting again, my wife noticed, oh my gosh, your skin is all of a sudden more oily again. You've got more blackheads. You've got some more acne on your back popping up, and it had cleared up after the Kyzatrex. And so we really got to see firsthand that those side effects really are significantly less using the oral Kyzatrex versus the injectable. So how does it work if you want to get on Kyzatrex? Whether you're on injectable testosterone or not will make a difference. So if you are, then we'll probably taper you off as we start the oral Kyzatrex. If you're not, then we just start oral Kyzatrex. It is a pill that you take twice a day. I teach my patients to take it in the morning with breakfast and then in the afternoon with lunch. There is some anecdotal evidence that you can take it later in the day if you are planning any sexual activity or you want your energy to last a little bit later throughout the end of the day. Because it is an oral pill, you are getting those levels that come up throughout the day and then they slowly come down at night, helping you sleep. Whereas with injectable testosterone, you're maintaining kind of a steady state of testosterone throughout. So those are some of the small differences with the oral testosterone. So to recap, if you are concerned that you have low testosterone, or if you're wondering, I don't know if I have it, or if you're like, man, I need to be on this testosterone because it's going to help me live longer, the easiest way to do that is just reach out to me through Instagram, or you can reach out to us at the Elevation Health Instagram account, and we can get you set up. We're going to start with some lab values. We'll start with an interview process, and based on your results, we'll get you on either injectable testosterone or Kyzatrex. Kyzatrex currently is only prescribed by me in the state of Utah. I'm the local expert on testosterone. That's why I was tapped to be the first person and currently the only physician prescribing Kyzatrex in the state. And so right now, the only place you can get it is through me. Our program with Elevation is $360 a month. That covers your medications. It also covers your labs, as well as quarterly nurse visits with one of our staff to review your labs and to talk about where you're at in your levels as well. Any other questions, reach out to me directly. Let's get you going.